So, hi guys, my medication that I got is Bumetanide. Two of the common brand names are Bumex and Buranix. Bumetanide is a loop diuretic, so it can be given for edema, especially associated with CHF, hepatic and renal disease, also including nephrotic syndrome. They can also give it for hypertension. The initial dose is just going to be a one-time dose. If the response is not good enough, or not adequate enough, then they can put them on a schedule, and it's usually every 4 to 5 hours that they'll give it. The maintenance dose, after they've been started on it for a little bit, is an intermittent schedule. So that's usually every other day, or they'll take it for 3 to 4 days and then have 2 days in between taking your next dose. So some of the things you want to monitor when taking this is obviously your electrolytes and your vitals. Because it's a loop diuretic, it can cause hypokalemia and electrolyte depletion, but hypokalemia is one of the big ones. And it can also cause hypotension, because with loop diuretics, you're just gonna urinate and void all of the fluid out, so it can make your blood pressure drop. Some of the common adverse effects that you want to talk to your patient about whenever they're taking Bumetanide is going to be hypotension, hypokalemia, azotemia, muscle cramps, hypouricemia, hypochloremia. Stevens-Johnson syndrome has actually been seen, which is a dermatological condition. You'll kind of see it's a reaction, but their skin will start sloughing off, and a lot of places they'll get blisters and stuff, so it's pretty. And also thrombocytopenia can be seen when taking Bumetanide, so those are all things that you want to talk to your patient about when they're taking it. You also need to educate your patient on when to call a doctor. And when taking Bumetanide, you want to call a doctor when you're having signs and symptoms of volume and electrolyte depletion, which can mean they'll see things like dizziness, they'll be fatigued, they'll have tachycardia, hypotension, stuff like that. They also want to call the doctor if they're having signs and symptoms of hypokalemia, which could be muscle cramps, palpitations, excessive urination, and excessive thirst. And they also want to call the doctor if they develop hypouricemia. So it's pretty important for them to call the doctor for all those things. But that's it. Thank you guys so much.